As we observe World Family Doctor Day 2025 under the global theme, Building Mental Resilience in a Changing World, the relevance to our Jamaican context is undeniable. This year's local focus, the impact of the aging population on primary health care, chosen by the WFDD Jamaica Planning Committee for our CME conference, underscores a critical intersection, mental resilience and the challenges posed by an aging population that demands urgent attention from healthcare stakeholders, both for our patients and our healthcare professionals. Jamaica, like many other nations, is undergoing a significant demographic shift. The percentage of individuals aged 65 and older is steadily rising, as confirmed by data from the Statistical Institute of Jamaica. This aging trend brings with it a host of complex health needs, extending beyond the physical to include profound mental health concerns. Chronic non-communicable diseases, cancer, dementia, and cognitive decline are common, but so too are less visible issues like depression and loneliness, which are often exacerbated by social isolation and loss of independence. As these conditions increasingly co-occur, they place an unprecedented strain on Jamaica's already overburdened primary healthcare system. The demand for comprehensive, integrated care for the elderly is rising disproportionately, even as their capacity to independently finance their health needs diminishes. This shift presents not just a medical challenge, but a social and economic one, as a shrinking working-age population is left to carry the growing cost burden of elder care. Currently, the financing of healthcare for the elderly relies on a combination of public and private resources. However, the vast majority of older Jamaicans depend heavily on public health infrastructure, including community clinics and hospitals, and benefit from programs such as the National Health Fund. With demand rising and resources stretched, the sustainability and accessibility of these essential services are increasingly at risk. Moreover, as the younger population base grows at a slower pace, the availability of trained healthcare professionals may not keep up with the expanding needs of an aging demographic. This mismatch threatens not only the quality of care, but also the mental and emotional well-being of the very professionals tasked with delivering it. Our primary care providers are at the forefront of this demographic transition. They confront daily the complex realities of caring for older patients with multiple coexisting conditions, many of which have strong psychosocial components. The emotional burden of managing chronic illness, cognitive impairment, and social decline among elderly patients, often without adequate time, staffing, or support, contributes to a growing crisis of provider burnout. Physicians and healthcare professionals are not immune to the very mental health challenges they treat in others. Burnout, compassion, fatigue, anxiety, and depression are real and growing threats within the healthcare workforce. If not addressed, these issues will erode the resilience of the system itself. To remain effective, primary care providers must prioritize their own well-being. Many do so by embracing self-care strategies such as regular physical activity, healthy eating, and adequate sleep, seeking support through counseling, establishing strong peer networks, and practicing mindfulness are increasingly essential tools in maintaining mental health. Setting boundaries between work and personal life, though often challenging, is crucial in preventing long-term burnout. Healthcare institutions, too, must take responsibility. This includes ensuring adequate staffing, offering mental health resources, and fostering a supportive, stigma-free culture around seeking help. Promoting wellness within the profession isn't optional, it's foundational to delivering high-quality care. The demographic reality of an aging Jamaica poses a profound and multifaceted challenge. If we are to meet it successfully, we must invest not only in better infrastructure and sustainable financing models, but also in the people who keep our system running, our frontline providers. As we commemorate World Family Doctor Day 2025, let us embrace the dual challenge of aging and mental resilience with innovative, integrated, and compassionate strategies. This means designing a health system that simultaneously addresses the physical, mental, and emotional needs of our elderly patients, while supporting the professionals who care for them. By doing so, we will not only safeguard the health of our older citizens, but also build a more resilient, responsive, and sustainable healthcare system for the future. Together we can rise to meet the demands of a changing world, stronger, more united, and more prepared than ever. By Dr. Donald Gordon, President, Association of General Practitioners of Jamaica.